If you're over 60 and you live alone, or even spend part of the day alone, I need you to listen carefully. Because when it comes to a heart attack, the biggest danger is not always the pain itself. It's hesitation. It's the lost minutes. It's the moment when someone feels something is wrong, but they sit there hoping it will pass. And that hope can be deadly. I want to be very clear with you right from the start. A heart attack is not the time to be tough. It is not the time to be polite. It is not the time to worry about causing a fuss, bothering a neighbor, or overreacting. If your heart is in trouble, your job is not to be brave in silence. Your job is to act fast enough to stay alive. After 20 years as a Navy SEAL, I can tell you this. In a real emergency, people do not rise to the level of their good intentions. They fall to the level of their preparation. And that is exactly why this matters so much for older adults. If you already know what to do, you are far less likely to panic. If you panic less, you waste less time. And when it comes to the heart, time matters. So today I want to walk you through 7 simple actions every older adult should know if a heart attack happens while you're alone. These are not complicated. They are not dramatic. They are the kind of steps that can buy precious minutes, reduce damage, and give emergency help a better chance to save you. And I want you to stay with me all the way through, because some of the most important steps are the ones people forget in the middle of fear. Let's start with the first and most important one. Call emergency services immediately. Not in 10 minutes, not after a glass of water, not after you lie down just to see. Immediately. If you feel crushing pressure in the chest, pain that spreads to the arm, back, neck, or jaw, sudden shortness of breath, cold sweat, dizziness, or a wave of nausea that feels different and alarming, assume it could be a heart attack until a doctor tells you otherwise. Do not waste time trying to diagnose yourself from the couch. This is where people get into trouble. They bargain with the symptoms. They call it indigestion. They call it fatigue. They call it stress. They tell themselves they'll wait a little longer. And every minute they wait, the heart muscle may be losing blood flow. I want you to make a decision right now, before any emergency ever happens. If you ever feel those warning signs, you call first. You do not debate first. You do not search online first. You do not call a relative first to ask what they think. You call emergency services. That decision alone can save your life. A lot of people over 60 grew up in a culture that taught them not to complain and not to make trouble. That mindset can become dangerous in a medical crisis. A heart attack does not care whether you are polite. It cares whether you move fast enough. So, if the symptoms hit, pick up the phone and make the call. Then comes the second step. If you have aspirin available and you are not allergic to it and have not been told by your doctor to avoid it, chew it. Not swallow it whole, chew it. This matters because in many heart attacks, a clot is blocking blood flow to the heart. Aspirin can help reduce clotting, and chewing helps it get into your system faster. That speed matters when every minute counts. Now I want to be responsible and plain here. If you have an aspirin allergy, a bleeding disorder, a history of serious bleeding problems, or your doctor has specifically told you not to take aspirin, skip this step. In that case, your focus stays on calling for help, staying calm, and following emergency instructions. But if aspirin is safe for you, this is one of the smartest things to keep in your home where you can reach it quickly, not buried in the back of a cabinet, not somewhere upstairs if you spend your evenings downstairs. Reachable, visible, ready. Prepared people do better in emergencies because they remove small obstacles before the crisis ever begins. The third step is simple, but many people overlook it. Unlock your door and keep your phone with you. This sounds almost too basic, but in an emergency, small barriers become big ones. If help arrives and your front door is locked, those extra minutes matter. If your phone is across the room, on a charger, or in another part of the house, those few steps may be too much. So once you have called for help, unlock the door if you can do it safely without overexerting yourself. Then sit down near the entrance if possible, or wherever you can stay still and safe. Keep your phone in your hand or on speaker beside you. Think about what this does. It makes you easier to reach. It helps responders get to you faster. It keeps the line open in case they need to speak with you again. And it reduces the chance that you will collapse somewhere farther from help. A lot of seniors live alone and feel they have to manage everything themselves. But this is not the moment to manage. This is the moment to clear the path for rescue. The fourth step is to sit upright and loosen anything tight. If you are having severe chest discomfort or trouble breathing, do not lie flat unless emergency personnel instruct you to. Sitting upright with your back supported can make breathing easier and reduce some of the strain on your system. Loosen a tight collar, loosen a belt, remove anything restrictive around the chest or waist. You are trying to give your body room to breathe, room to move air, room to stay as stable as possible while help is on the way. This is especially important for older adults who already have reduced endurance, lung issues, or feel panicky when breathing becomes difficult. A poor position can make the whole experience feel worse. A better position can help you stay calmer and keep more control. I want you to picture this clearly. You are not pacing. You are not wandering around. You are not trying to tidy up or gather things. You are seated, supported, clothing loosened, phone nearby, door unlocked, help on the way. That is the posture of survival. The fifth step is one people do not always expect. Breathe slowly and deeply. Panic is gasoline on this situation. When fear takes over, your body floods with stress. Your heart rate climbs. Your blood pressure may rise. Your breathing becomes shallow and fast. And all of that can place even more strain on a heart that is already in trouble. That is why controlled breathing matters. I want you to inhale slowly through your nose if you can, letting your belly rise more than your chest. Then exhale slowly through your mouth, even longer than the inhale if possible. Not forced, not dramatic, just steady. Your only job is to make the next breath calm, then the next one, then the next one. This does two important things. It helps bring in oxygen, and it also gives your mind a job that keeps it from spiraling. Fear wants your thoughts racing in 10 directions at once. Breathing narrows your focus. It tells the nervous system, stay here, stay organized, stay with me. And I want to say something that may help someone hearing this. Calm does not mean unafraid. Calm means you are directing your fear instead of letting it direct you. You may be frightened, and that is normal, but you can still breathe slowly. You can still stay with the plan. Now the sixth step is just as important as any of the others. Stay still. Do not try to walk it off. Do not decide this is the moment to go upstairs, grab a bag, get dressed properly, water the dog, or meet the ambulance outside if doing so means exertion. Once help has been called and you are in a safe place, stay there. Every unnecessary movement can increase the workload on the heart. During a heart attack, the heart is already struggling. It does not need more demand from climbing stairs, hurrying around the house, or pacing in fear. This is a hard one for many people, especially strong, independent people. They want to do something. They want to stay in control by staying active. But in this situation, stillness is not weakness. Stillness is strategy. I've seen it in every high-pressure environment. The people who do best are not always the strongest. They are the ones who stop making things worse. So once you have taken the key steps, do less, breathe more, wait for help. Now there is one more step I want to include, and I want to handle it carefully. If you feel suddenly faint, like you may pass out before help arrives, some people are taught to cough forcefully and repeatedly while waiting for emergency responders. This is not a cure. It is not a replacement for calling emergency services. It is not something to rely on instead of real medical treatment. But if you feel your vision narrowing, your head getting light, and you feel yourself slipping toward unconsciousness before help gets there, forceful coughing may help you stay alert for a short time. Again, this is not the main plan. The main plan is still simple. Call immediately. Take aspirin if safe for you. Unlock the door. Sit upright. Breathe slowly and stay still. That is the core. And now I want to pull all of this together in the exact order I would want you to remember it. You feel the warning signs. You call emergency services immediately. If aspirin is safe for you, you chew it. You unlock the door. You keep your phone with you. You sit upright and loosen tight clothing. You breathe slowly and deeply. You stay as calm and still as possible. That is the sequence. Simple, clear, repeatable. And that repeatable part matters. Because in a crisis, you do not want 7 scattered ideas. You want a short survival map your mind can follow even under stress. Now let me say something else that matters just as much. Preparation starts before the emergency. Do you know your address well enough to say it quickly if you are scared? Do you keep your phone near you at night? Do you have aspirin in the house if your doctor says it is safe for you? Is your front door difficult to unlock? Do your family members or neighbors know you live alone? Do you wear a medical alert device if you have significant heart risk? These are not dramatic questions, but they are the kind of questions that make emergencies go better. Most people do not prepare because they assume they will think clearly when the time comes. But fear changes people. Pain changes people. Age changes reaction time. That is why preparation matters. It reduces the number of decisions you must make while under pressure. And if you have had heart problems before, high blood pressure, diabetes, a prior stroke, high cholesterol, or a strong family history of heart disease, this is even more important. Not because you should live in fear, because you should live ready. Ready is different from fearful. Ready means the aspirin is where you can reach it. Ready means you know your emergency number. Ready means your phone stays nearby. Ready means you do not waste time pretending serious symptoms are nothing. That is how adults stay alive. Not with denial, with readiness. I also want to speak to the people who tend to minimize their symptoms because they don't want to scare their children or inconvenience anyone. Please hear me. A brief false alarm is always better than a fatal delay. The people who love you would much rather have you call and be wrong than stay silent and collapse alone. So do not protect other people from your emergency by hiding it. That is not kindness. That is risk. Protect yourself by acting. And for those of you listening who are healthy right now and feel fine, good. That is exactly when you should learn this. Not later, not after a scare, not after a hospital visit. Learn it while your mind is calm, and talk it through with the people you care about. Go over it once. Write it down if you need to. Keep it simple enough that you could remember it under pressure, because when people survive emergencies, it is often not because they did something extraordinary. It is because they did a few ordinary things fast enough and in the right order. That is the goal here. Not panic, not perfection, just the right actions at the right time. So let me leave you with this. If you ever think you may be having a heart attack while alone, do not wait for certainty. Call for help. Chew aspirin if it is safe for you. Unlock the door. Keep the phone close. Sit upright. Breathe slowly. Stay still. That is your job. Your job is not to be tough. Your job is not to be quiet. Your job is not to figure it all out alone. Your job is to buy time and let help reach you. And if nobody has told you this directly, let me say it now. Being prepared is not being negative. It is being wise. It is one of the most respectful things you can do for your own life. You are not helpless. You are not powerless. And in an emergency, the first few minutes can belong to you if you know what to do. Learn the steps. Keep them close, and be ready to use them.